नमस्ते, हमेशा खुश रहो बिटिया. I am JV'n Dr. Meenakshi, Assistant Professor in Department of Shalakya Tantra in Faculty of Ayurvedic Sciences at Jayoti Vidyapeeth Women's University. Today in this session we will discuss about an important disease of the palate, that is the tumors of palate. We include it in the Talugat Rog, which is again included in the classification of the Mukh Rog. So, shall we start? First of all, you should know about the two terms. These are tumor and neoplasia. What is tumor and what is neoplasia? These are two different things we should know. Tumor, it is a swelling of the tissue. Whereas what is neoplasia, it is an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of the normal tissues and persists in the same excessive manner after cessation of the stimuli which evoked that change. This definition of neoplasia has been derived from the Robbins Basic Pathology book, 10th edition. So, tumor is just a swelling, whereas neoplasia is the abnormal mass of tissue. Okay. Then we'll come on the carcinoma of palate. It is not a common lesion of the oral cavity. Then what are the clinical features of the carcinoma of palate? The growth of the palate is poorly defined, it is ulcerated and painful lesion. It will be seen on one side of the midline, and it frequently crosses the midline and may extend laterally to include the lingual gingiva or posteriorly to involve the tonsillar pillar or even the uvula. And this carcinoma may invade the bone or occasionally the nasal cavity, while infiltrating lesions of the soft palate may extend into the nasopharynx. Metastasis occurs quite commonly. So, in case of the carcinoma of palate, the metastatic condition, it is very common. You should know what is metastasis. Metastasis is an important term in case of carcinoma. Okay. So, if there is metastasis, then it becomes more towards the poor prognosis. Okay. Then what is the treatment of carcinoma of palate? In brief, you can say that both surgery and X-ray radiation are used. Okay. So we should go for the radiation therapy, whereas as well as the surgical procedure. So metastasis is the spread of cancer cells to the new areas of the body. It is done often by the way of the lymphatic system or blood stream. Okay. So a metastatic cancer or metastatic tumor is one that has spread from the primary site of origin or where it started into the different areas of the body. That is the metastasis. Okay, it is a pathogenic agent spread from an initial or primary site to a different or secondary site within the host body. And the term is typically used when referring to the metastasis by a cancerous tumor. Okay. Then we come to the carcinoma of the hard palate. Okay. First, we will discuss about the variety of the carcinoma of hard palate. First is the squamous cell variety. Okay, you know about the squamous cells. What are the squamous cells? These are the squamous cell carcinoma. In short, we call it the SCC. It is the second most common form of the cancer, and it is usually found on the areas of the body which are damaged from the UV rays or tanning, and in case of the skin cancer. But here we are discussing about the hard palate. Okay. So squamous cell carcinoma is a very common type of a cancer. Okay, it is a very important type of a cancer. Okay, so palate, as you know, it is anatomically divided into the hard palate and the soft palate. And you also know that the hard palate is a part of the oral cavity, whereas the soft palate is a part of the oropharynx. Okay, so half of the hard palate cancers are squamous cell carcinomas. These are the most common variety of the cancers of the hard palate. The second variety is the glandular variety, which is also very common. It arises from the minor salivary glands of the palate and may be adenoid, cystic, mucoepidermoid, or adenocarcinoma. And it may be common in people who have the habits of reverse smoking. Okay, so you know we have told about the glandular variety. Then here they are saying about the minor salivary glands which are present in the palate. Okay, they are most numerous salivary glands at the junction of hard and soft palate. So these glands in the palate, they are very prone to cancerous condition. So it is also a common type of carcinoma of the hard palate. Okay, then they have said that the minor salivary glands of the palate and also it can be adenoid cystic. Okay, this carcinoma can be adenoid cystic. So adenoid word is used where there is an involvement of the gland. Okay, so adenoid cystic carcinoma, it has a short form of ACC. Okay, ACC is an uncommon tumor which is characterized by the slow growth and high potential for recurrence. Okay, this is again a type of the carcinoma of the minor salivary gland. Then there is mucoepidermoid carcinoma. Okay, the carcinoma of the minor salivary glands of the palate can be mucoepidermoid or mucoepidermoid carcinoma, which is MEC. It is also the most common malignant neoplasm of the minor salivary glands, and these are the malignant tumor of the salivary glands, and so it is also very common. Okay. Then next is the adenocarcinoma of the minor salivary gland of the palate. Okay. Usually we don't use the term polymorphous low grade adenocarcinoma or PGLA, and this is a malignant tumor of minor salivary gland which is slow growing and carries a low metastatic potential. Okay, so there is also cribriform adenocarcinoma of the minor salivary glands. Okay, which is a very rare, and so these are all the types of the glandular variety of the carcinoma of hard palate. Okay, and next slide we will discuss about the symptoms of the carcinoma of the hard palate. The cancer starts as a superficial ulcer with rolled out edges and gives no symptoms except painless irregularity on the palate felt by the tongue. So initially you will not see any such big growth of the carcinoma on the hard palate. There will be only a superficial ulcer. Okay, you will see a superficial ulcer and it may also be ignored sometimes. So you should see about the edges of the ulcer. Okay, you should observe the edges of the ulcer. And in case of the squamous cell carcinoma, the edges of the ulcer are rolled out. So if there is rolled out edges, that it means a squamous cell carcinoma. Okay, if there is raised or pearly white and beaded edges, then there can be rodent ulcer, or if there is punched out edges, it can be syphilitic ulcer. So we should examine the ulcer. Okay? This portion comes up in the examination of ulcer. Okay, if the rolled out or vertige is there, then it indicates the squamous cell carcinoma, and there are no other such symptoms which make us think about the squamous cell carcinoma. There is painless irregularity of the palate, and which can be felt by the tongue. Okay, if there is rolled out edges and there is painless irregularity, then we should make a provisional diagnosis towards the squamous cell carcinoma. Okay, so you know about what is ulcer. It is as a break in the continuity of the surface epithelium with superadded infection. So we should first do the examination of the ulcer. Then next symptom, it may spread to the gingiva, lip, soft palate, or invade the bone of hard palate, floor of the nasal cavity, or the antrum. So as we have discussed that the squamous cell carcinoma is a type of malignant carcinoma. It is a malignant carcinoma, or it is a cancer. So it may spread to the different sites from the primary site, like it may spread from the hard palate to the gingiva. Okay, what is gingiva? Gingiva is the gums. In case of the medical terms, we call it the gingiva. So it is an anatomical term for the gums. Okay, so it may spread to the gums, it may spread to the lip, it may spread to the soft palate, which is a part of the oropharynx, or it can invade the bone of hard palate. Also, it can invade the part of the hard palate. Bone can be invaded, and then we come to the next, that is the floor of the nasal cavity. It can also invade the floor of the nasal cavity, and it can also invade the antrum. Antrum is the cavity on either side of the nasal septum. Okay, and extending from the nares anteriorly to the choana posteriorly, which is communicating with the paranasal sinuses through the orifices in the lateral wall. So there is the nasal antrum. It has the mucus-secreting cells and gastrin-secreting endocrine cells. So here is an image of the carcinoma of the palate. You can see clearly there is a scar or ulcer in the palate on the left side. You can see the ulcer, the discontinuity of the surface, epithelial surface. In the right side there is a growth, which you can see. It is a painless growth. This is the CA hard palate. Then we come to the risk factors of the carcinoma of hard palate. Okay, so first one is the smoking and cancer. This is the most important risk factor in case of the carcinoma. Smoking can also cause the lung cancer, but it may also cause the palate cancer. Okay. So it is an important factor that we should tell patient to quit smoking if we think that patient is developing cancerous condition. So cigarette smoking or bead smoking, these should be avoided. They may damage your airways also and may lead to the palate cancer. Okay, because a cigarette, it contains about around 4,800 chemicals, and 69 of which are cancer triggers. So if they trigger the cancer, it becomes a very much risk factor. So next is the alcohol. Okay. Alcohol is also injurious to health. Abuse is disastrous for health. It impacts our entire body and cause a range of health problems, liver damage, cirrhosis, diabetes, even cancer. Okay, so it should be avoided. Then pan, chewing pan is also very important risk factor in case of the cancer. So we should avoid the pan. Pan is a betel leaf or the betel nut quid, and they used with or without tobacco. So it has been positively associated with the oral cancer. Mostly the oral submucous fibrosis, which we call the OSMF, it is a precancerous condition. It is caused by a pan. And so pan without tobacco or with tobacco, these are both likely to develop oral cancer as compared to the non-users. So these both are dangerous for our oral cavity. Okay. The next thing is the gutka. Gutka has led to the highest incidence of oral cancer. Okay. It is a major tobacco hazard, and because they use the tobacco product in it, and chewing tobacco, and it is placed in the mouth, usually between the gum and the cheek, and gutka contains nicotine and many harmful cancer causing chemicals in it. So they may all lead to the oral cancer, especially the cancer of the hard palate. Okay, it may lead to the nicotine addiction. Okay, so this is an important factor in case of the carcinoma of the palate. Okay, so next is the naswar. Naswar is a smokeless tobacco. Okay, so with the use of the naswar, there is also a risk of oral cancer. Okay. Females have usually the risk of oral cancer with the use of naswar. Okay, it is a powdered tobacco used for addiction purpose. It is a smokeless tobacco. Then next important thing is the reverse smoking. You must have heard about smoking, and here is the term reverse smoking, in which the burning part of the cigarette or burning part of the bidi, it is placed inside the mouth, and then the smoking is done. That is called the reverse smoking, and reverse smoking is much more harmful as compared to the normal smoking. Okay, when the burnt end of a hand rolled tobacco leaf is put in the mouth rather than the unlit end of the cigar. So it is practiced in some parts of the India. It is very harmful. Okay, so these are all the important factors for causing the cancer. And next is the shisha cancer. Okay, the smoke from hookah, they are the high levels of toxic agents, and hookah tobacco and smoke contain various toxic agents known to cause the oral cancers. And the tobacco juices from the hookahs irritate the mouth and increase the risk of developing the oral cancers. So shisha smoking is significantly associated with the oral cancer. So these are all the risk factors in case of the Then next comes the lymphatic metastasis. Lymphatic metastasis may spread to the submandibular or upper jugular nodes. So the cancer of the oral cavity, it may also spread to the lymphatic system, and they have mentioned the two lymph nodes, the submandibular and the upper jugular nodes. Okay, where are the submandibular nodes? They are, submandibular means below the mandible. So these two lymph nodes are very much affected during the cancer. Okay, then next point is the differential diagnosis. Cancer palate should be differentiated from cancer of the maxillary antrum or nose which has spread to the palate. Okay, we should make a clear diagnosis between the cancer of the palate and the cancer of the maxillary antrum. We should not get confused among this. Okay. Also, if there is cancer of the nose and it has spread to the palate, then it should also be differentiated very significantly. So differential diagnosis is very important in case of the carcinoma of the palate. Okay, because maxillary sinus squamous cell carcinoma is very aggressive. Okay, and it may also cause a destruction of the palate. So we may get confused that maybe it is the cancer of the palate. Okay. When next we come to the staging of the disease. The American Joint Committee has decided a TNM classification on cancer. It is a very important classification in case of the carcinoma of the staging of the oral cancer. Okay, the TNM classification. T means tumor. Okay. T denotes the tumor, whereas the and denotes the regional lymph nodes, and this denote the distant metastasis. So first, what is Tx? It is a primary tumor, cannot be assessed. If we cannot assess the primary tumor, then we will term it as a Tx. If there is no evidence of the primary tumor, then we will say T0. Then we come to the T1. If the tumor size is equal to or less than 2 cm in greatest dimension, then it is T1. If the tumor is more than 2 cm but not more than 4 cm in greatest dimension, then we will term it as T2 stage. Okay, and if the tumor is more than 4 cm in greatest dimension, that is T3. The next is the T4A. T4A, if the tumor invades through the cortical bone, inferior alveolar nerve, into the deep muscle of the tongue, maxillary sinus, or skin. Skin may be of chin or nose, then it is termed as a T4A. Okay. Also the lips. In case of the lips, there will be involvement of cortical bone, inferior alveolar nerve, floor of mouth, skin. Then T4B, it is related to the lip and oral cavity. If the tumor invades the masticator space, pterygoid plates, or skull bone, or in cases the internal carotid artery, then it is termed as the T4B. Then next is the N stage. When the regional lymph nodes cannot be assessed, it is termed as NX. When there is no regional lymph nodes metastasis, it is termed as N0. If the metastasis in a single ipsilateral lymph node 3 cm or less in greatest dimension, then it is termed as N1. Metastasis in a single ipsilateral lymph node is termed as N1, and next metastasis in a single ipsilateral lymph node but more than 3 cm but not more than 6 cm in greatest dimension, that is known as N2A. Next is N2B, when the metastasis is in multiple ipsilateral lymph nodes but none more than 6 cm in greatest dimension. That is termed as N2B. Next is the N2C, when metastasis in bilateral or contralateral lymph node none more than 6 cm in greatest dimension. That is termed as N2C. Then N3, the metastasis in a lymph node more than 6 cm in greatest dimension. It is termed as the N3 stage. Then comes the M stage, which is termed as a distant metastasis. MX means it cannot be assessed. MO means no distant metastasis. M1, when there is distant metastasis present. These was all the staging of the carcinoma of palate. The next is the investigations which should be done in case of the carcinoma of the palate. First, we should go for the biopsy. In case of biopsy, a small sample of the tissue will be taken from the palate in order to examine it more closely, and the doctor should recommend a biopsy when an initial test suggests an area of tissue in the body is normal. So, doctors may call an area of the abnormal tissue a lesion, a tumor or a mass, and its biopsy should be taken so that we can send the tissue for the further histopathological examination. If cancer is present, then it may be ruled out. Okay. The next test is the OPG. Okay. OPG test should be done. It is the orthopantogram. Okay. It is the orthopantogram scan or orthopantogram test. It is a panoramic view of the mouth, teeth and bones of the upper and lower jaw. So it is called the orthopantogram test should be done. Then we should go for the CT scan, computed tomography, computerized tomography. It is a combined series of X-ray images taken from different angles around the palate and uses a computer processing to create the cross-sectional images of the bones, blood vessels and soft tissues. So it gives a clear view from the every angle of the tissue. Okay. Then next investigation that can be done is the MRI scan. We should do the magnetic resonance imaging. It is a medical imaging technique which is used in radiology to form pictures of the anatomy and the physiological processes of the body. And MRI scanners use strong magnetic fields, magnetic field gradients and radio waves to generate the images of the organs in the body. So it is give a clear view if the cancer is present. So these all investigations can be done. Then next we come to the treatment part of the carcinoma of palate. First, if there is small tumor or T1N0, that can be treated with the radiotherapy or the surgery. If there is T2N0, T2 says that tumor is more than 2 cm but not more than 4 cm in greatest dimension, and N0 means no regional lymph node metastasis. In that condition, it can also be treated by radiotherapy, including the neck nodes, and they can also be treated by surgical excision with prophylactic neck dissection. Then there is stage 3 or stage 4. Okay. Stage 3 are T1, T2, N1, M0 or T3, N0, N1, M0. So these tumors require combined treatment with surgery and post-operative radiotherapy. Hemiglossectomy, including a portion of the floor of the mouth, segmented or hemimandibulectomy, and block dissection of the neck. It is called the commando operation. So commando operation is the operation of the carcinoma of palate. So if any question of MCQ is asked regarding it, then we say it is the operation for the malignancy of the oral cavity. Commando full form is combined mandibulectomy and neck dissection operation. Okay, COM means combined, MA means mandibulectomy, and N for neck, D for dissection, O for operation. Okay, it is a complicated operation for the first degree malignancy. It comprises the glossectomy and hemimandibulectomy. Okay, so it is called the commando procedure. Next is the small tumors are dissected along with the underlying bone, and larger ones require the partial maxillectomy. If nodes are enlarged, block dissection is also combined. A surgical defect in the palate left after excision of the growth is closed by a suitable prosthesis. Okay, thank you so much. This session completes here. This session of Digital Version 2.0 Jayoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box. I will resolve it soon. Thank you so much.